can imagine that your 2-year-old child has been up all night. She's been really sick, she's been vomiting, she's had diarrhea, and you've been wondering, should I take her to the emergency room? You get a hold of your local physician, and she says, go ahead and take her in. So the first thing you do when you get to the ER is you check your kid in, and then there's a nurse that sees your child and assesses the level of severity of their illness and how urgent care is getting. And she's going to test and look at a lot of different things about your child. For example, their temperature and their dehydration. And surprisingly enough, dehydration is a really common thing for children in an emergency room setting. I talked to Katie, who was the nurse at St. Louis Children's Hospital, and when she was there, she said it was all diarrhea and dehydration, the kids that she saw coming in. And she said that if it's a really severe case, she knows, but if it's a mild case, it's kind of gray area as to what the treatment path is going to be. So going back to looking at temperature and dehydration, if you're taking someone's vitals and you're taking their temperature, this is what the measurement looks like. You have a readout, you have a display, and you know what it is. If you're looking at their dehydration, you look at things like skin turgor, sunken fontanelle, responsiveness, vomiting, this whole galaxy of little pieces of qualitative information that give you a guide as to how dehydrated they are, what the treatment path is going to be for them. Sure, there are some quantitative ways of measuring this. It means for taking a blood sample, having physician oversight, bringing it to a lab, and solutions that are wholly inappropriate for an emergency room setting. And there's a decision that's made every time that a nurse assesses this dehydration, and that's whether or not to administer an IV. And the thing about IVs with children is that they can be a really traumatic experience, especially when you're talking about dehydration, a really common symptom in an emergency room. It can be traumatic for the child because they don't understand why they're receiving the IV. It can be traumatic for the parents who have to watch their child undergo this procedure and who are likely having their first experience with the medical profession or medical setting. And surprisingly enough, when you talk to ER staff, it can be traumatic for them. I mean, they got into this work to help people and to make them feel better. And to put a child through this kind of experience is not something that they want to do. So what I'm going to talk about, what I've been working on, is taking dehydration from the qualitative realm of assessing this galaxy of information and into a quantitative place where people can know in the moment what the level of someone's dehydration is and get an accurate reading that indicates actionable information. And Index is a device that does that. With Index, you take the patient's finger, ask them to place it inside, press the lever, wait a couple of seconds, and you get your information that you need. You get the percentage of the hydration of your patient. So how does this work? I've been talking to Dr. Bezaritas at Boston Children's Hospital, who's been working on research that aligns the capillary refill time with an accurate measurement of someone's level of hydration. So capillary refill time is the time that it takes. So you compress the fingertip, you can do this right now, and blanch your fingertip, and then you release it, and the time that it takes for your fingertip to return to normal is your capillary refill time. And you can watch it, but you can't get a precise measurement of it, but Index can. So Index works in the exact same way. Presses the finger with the compression arm. When it reaches the appropriate amount of force, the lever arm automatically releases, and optics inside of Index track that refill time just using LEDs and measuring the reflectance of the finger. And then it resets and you get your reading. So, but it's not enough to make Index work. It has to fit the context and it has to fit people's lives. So that's why I'm strove to make Index familiar, reassuring, and non-invasive to help physicians and nurses make better decisions in the ER. So it's familiar because it matches the form of a lot of different medical devices. The otoscope and the ear thermometer were a couple of devices that I heard from nurses and physicians being really familiar devices and devices that they named as the ones that they enjoyed using, and also from patients as these being these being the ones that they were least threatened by. So following that form, I arrived at the vector that I showed you with index, and part of what reinforced this is when I showed nurses an array of different potential forms for devices and potential interactions. This is one that they held throughout the interview. We're actually talking about a hospital process, and he's playing around with the device as I'm talking to her. It's reassuring. It shows you data, but raw data like this is actually really important in ER. Not only does it give the nurses and physicians actionable information, but it gives parents the number. And the number is really important. And sometimes it doesn't even matter what that number is. It can be as little as, your child's at 94%, we need to get them to 100%, and then you can go home. That's really important for parents to feel like their child is okay, rather than, oh, your child's dehydrated, we have them, we're treating them, and we'll watch and see how it goes. And being non-invasive is another really important thing. Every physician and nurse that I spoke to talked about how, as much as possible, we try to avoid invasive procedures with children, just because it's really challenging and it's not a pleasant experience. In some hospitals, they even have a separate room that they bring the child to perform invasive procedures to try and help the child feel better about their stay in the hospital. So index is great for nurses because not only does it help them triage and even not admit patients who don't need admission into the hospital, but it empowers them to take measurements and assess their patient's status without the need for expensive and invasive procedures or physician oversight. It's great for parents because it reassures them and lets them know exactly what's going on with their child. And it's great for kids because it helps them avoid potentially invasive procedures that could lead to complications and pain. And Dr. Bezaritas and I think that ER is the most impactful place that we can start with this technology, but we've had discussions that where, because of the simple nature of the technology, we've got great applications in places like athletics or home medicine, or even in developing nations where diseases like dysentery are a severe problem, and you need a way to really gauge someone's hydration quickly and move through a lot of people. So, hundreds of years ago, we used to measure a fever by placing the back of our hand on a person's forehead. And what I'd like to do for hydration what the thermometer did for temperature. And I think index is a step in that direction. Thank you.